Diabetic management regarding exercise. The therapeutic goal for diabetes management is to achieve normal blood glucose levels, that is euglycemia, 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 that is without hypoglycemia and without seriously disrupting patient's usual lifestyle and activity. There are 5 components. First one is nutritional management, second exercise monitoring, third one, fourth one pharmacologic therapy, fifth one education. So we will see the exercise benefits of exercise is extremely important in managing diabetes because of its effects on lowering blood glucose and reducing cardiovascular risk factors. Exercise lowers the blood glucose level by increasing the uptake of glucose by body muscles and by improving insulin utilization. It also improves circulation and muscle tone. Resistance, that is strength training such as weight lifting, can increase lean muscle mass, thereby increasing the resting metabolic rate. These effects are useful in diabetes in relation to losing weight, easing stress, and maintaining a feeling of well-being. Exercise also alters blood lipid levels, increasing levels of high density lipoproteins and decreasing total cholesterol and triglycerides level. This is especially important to person with diabetes because of the increased risk for cardiovascular disease. Exercise precautions are patients who have blood glucose levels exceeding 250 mg per deciliter, that is 14 millimole per liter, and who have ketones in their urine should not begin exercising until the urine test negative for ketones and the blood glucose level is closer to normal. Exercising with elevated blood glucose levels increases the secretion of glucagon, growth hormone, and catecholamines. The liver then releases more glucose, and the result is an increase in the blood glucose level. The physiologic decrease in circulating insulin that normally occurs with exercise cannot occur in patients treated with insulin. Initially, the patient who requires insulin should be taught to eat 15 grams of carbohydrate snack or a fruit exchange or a snack of complex carbohydrate with protein before engaging in moderate exercise to prevent unexpected hypoglycemia. The exact amount of food needed varies from person to person and should be determined by blood glucose monitoring. Some patients find that they do not require a pre-exercise snack if they exercise within 1 to 2 hours after a meal. Other patients may require extra food regardless of when they exercise. If extra food is required, it need not to be deducted from the regular meal plan. Another potential problem for patients who take insulin is hypoglycemia that occurs many hours after exercise. To avoid post-exercise hypoglycemia, especially after strenuous or prolonged exercise, the patient may need to eat a snack at the end of the exercise session and at bedtime and monitor the blood glucose levels more frequently. Exercise recommendations. People with diabetes should exercise at the same time, preferably when blood glucose levels are at their peak and in the same amount each day. Regular daily exercise rather than sporadic exercise should be encouraged. Exercise recommendations must be altered as necessary for patients with diabetic complications such as retinopathy, autonomic neuropathy, sensory motor neuropathy, and cardiovascular disease. In general, a slow, gradual increase in the exercise period is encouraged. For many patients, walking is a safe and beneficial form of exercise that requires no special equipment except for proper shoes and can be performed anywhere. People with diabetes should then discuss an exercise program with their physician and undergo a careful medical evaluation with appropriate diagnostic studies before beginning an exercise program. So general precautions are use proper footwear and if appropriate other protective equipments. Second one, avoid exercise in extreme heat or cold. Third one, inspect feet daily after exercise. Fourth one, avoid exercise during periods of poor metabolic control. Thank you.